Hi, everyone. We're back. We're just waiting for one more of our speakers. She's not quite in yet, but in the meantime, we're going to start with the speakers who are here. So welcome to all of them. I'm going to turn the gavel over to Mark Obbie. Hello, everybody, and hello, Mark.
Hello. So I am Mark Obbie. I'm the criminal justice specialist at the Solutions Journalism Network. And our panel today is going to talk about what's been happening in local jails during the pandemic, both with some overall data and some ground level experiences, and talking about the lessons that we've learned that for moving forward. So it's both a focus on problems and solutions. And I dropped a couple links in the chat with a plug for the kinds of resources that the Solutions Journalism Network provides on this. I put together a collection of stories fairly recently on the COVID experiences in jails that started out very strongly, started out very positively, and then, of course, went downhill throughout the year last year. But the lessons that some communities have learned around the country, and journalists have been covering these stories around the country. You can search the Story Tracker archive for story ideas and for examples of what works. And that's really the expertise that we have today on the panel. It's a large panel, although at the moment not as large as it was going to be, but we're hopeful. It's a large panel, so I'm going to streamline the introductions, and we're going to chunk up the conversation in a way that I hope makes the topic understandable to the audience here. We're going to start out. And we want to leave, of course, time for questions. So when you have questions, drop them in the Q&A. We're going to start out with Dr. Alysse Wurcel from the Tufts Medical Center. And she's an advisor to the Massachusetts Sheriff's Association and a specialist in infectious diseases among drug users and the incarcerated. And she's going to she and all the panelists are going to introduce themselves and tell us about the work that they do, but she's going to speak specifically about what we have been seeing in the jails as COVID hotspots. So why don't you start, Dr. Wurcel?
Thanks for having me. So I'm an infectious diseases doctor, and prior to COVID, I had NIH funding actually looking at ways to improve infectious care delivery in jails, and I was also the infectious diseases doctor in 6 jails. So I already was firmly footed within the jails and have about 20 years of experience working in jails when COVID hit. And early on, I think one thing that happened in Massachusetts that really helped us is that the Massachusetts Sheriff's Association actually hired me, meaning 25% of my time was dedicated to advising the Massachusetts sheriffs. And so it really meant early on, they had access to me. I was learning things quickly, trying to keep on top of things. And I guess one of the messages or the take homes is back a year ago, there were a lot of unknowns, and it almost seems like we have more unknowns right now. Every time we answer a question, it seems like another question pops up, and how frustrating that is to people who are trying to learn and keep on top of it. So the academic public health sheriff partnership that occurred really early on really enabled everyone to have kind of similar messages. Not that every sheriff did the same thing in each county. Each county would take a specific spin on it. And early on, every jail is shaped differently. So what their capabilities were for isolating, for quarantining, what their staffing situations were like, all of these things were often overlooked. I think when people are like, just do this or just do this, there were specific structural, organizational things that had to be listened to, and sometimes the perfect situation was not possible, and sometimes what perfect meant could be actually really dangerous for people who are incarcerated, meaning isolation and, long periods of isolation away from each other. So, we weathered the first wave of the pandemic. There were 2 deaths, both in, 40-year-old men, too many. And most of the jails actually, did have outbreaks. We did fine during the summer, and just like the rest of the country, we saw the second wave occur. We were more prepared with testing. I don't think we were as prepared with realizing the role of staff really is bringing in the disease. And so I mean, we knew that, we knew that happened in the first wave of the pandemic, but there is no doubt about that in the second wave of the pandemic, that as much as we focused on quarantining and testing people who were coming in, it was really people who were coming to work sick through no fault of their own, either potentially through their interpretation of human resource policies or through them not having symptoms, because we know one of the craziest things about this disease is that you can be asymptomatic and spread it. So much of my time has actually been working with human resources and occupational health and these other people setting. I think one of the greatest things is most of the jails have set up on-site testing for their employees. Now think about what it means if your employer tells you to get a test, what that means to stand in line, what it means that your insurance may not cover it, all these barriers. So trying to make it such a low barrier for the person saying, I have a little bit of a sniffle, a little bit of a sore throat, maybe I should get tested. If you could get tested at your place of employment, that's huge. And in doing so, we were able to identify many people who had the virus. We were able to put into place contact tracing. And that, I think, has helped us. That being said, we've still had a lot of COVID in all of our jails, despite all of our attempts to keep it out. Fortunately, Massachusetts is one of the states that's prioritized vaccination. And so I can say, even though my research on vaccination has shown about 10% of people in jails accepted the flu vaccine, historically, most jails are reporting to be between a 30 and 50% vaccine acceptance rate, which is honestly, it may not seem that high, but is incredibly high for this minoritized and marginalized communities to accept at this rates. And so as the vaccine rollout occurred, it took all hands on deck because obviously they were still doing testing, but they still had to do vaccination. So that's kind of where we're at in Massachusetts right now. We're still in the back of our minds. We're trying to figure, we have the Moderna and the Pfizer vaccine. So we have Moderna vaccine in the jails. I know some jails are waiting for the Johnson & Johnson to come through, but we started with the Moderna. There's a lot of questions that came up about, should people who are getting incarcerated be vaccinated if we can't assure that they're going to get 2 vaccines? And our process was always vaccine in arms. It does not matter when they're going, if they want a vaccine, they can get a vaccine, and then we'll support them on the outside. So actually re-entry coordinators have been used to try to coordinate helping people get vaccines on the outside. I'm not sure how good that's going. I can tell you, the whole process of scheduling for vaccines is so challenging that I imagine most of the people that have been released into the community are experiencing similar challenges in access vaccines. But overall, I think it's been wonderful. And just as a last note, I've done about 16 Ask Me Anything sessions where I go in with people from the community, whether they be reverends or virologists or, people who speak Spanish, all of this. And we basically go into a cell block, sometimes, 60, 80 people, socially distanced as much as possible, and say, we are not here to convince you to get the vaccine. I like to say I'm here to take you from hell no to hell maybe. And so, and then we ask these questions, and these questions are incredibly powerful, great questions. Someone asked if they could give it to their grandma instead. Someone, it's not just, I think a lot of people like to talk about people in jail asking about nanochips because it kind of makes them, it almost like fetishizes them in a very weird way. The questions that people in jail have about vaccines are good questions. They can be answered. And we can engage them in this process and empower them. But it's a decision that they have to make. And I'm very fully committed to being as ethical about the vaccine rollout as possible, not making any lies about it, not saying, this is going to prevent you from having to be quarantined if you go out to the court. It still means masks. So very transparent that this vaccine is not the end, but it's getting us closer. So I guess with that, I'm happy to take any questions. And thank you again for your time or for listening to me.
Great. We're going to save time for the end at the end for the questions. And as I said, please put them in the queue. I'm so glad that we have your medical expertise here on this panel, because the rest of the panel, as is typical of these sorts of conferences, is a criminal justice expertise, naturally. And so in this particular instance, it really helps to hear it from a doctor who specializes in this. Next up, we have Terry Schuster, criminal justice policy analyst from the Pew Public Safety Performance Project. And he has worked on jail reform policy proposals, as I understand it, in Michigan and probably elsewhere. So why don't you walk us through what the jail population dynamics have been, moving into state efforts to reduce jail populations as a preventive measure.
Great. Hi, everybody. My name's Terry Schuster. I'm with the Pew Charitable Trust. And just to level set, I guess, for any of you who whose reporting doesn't regularly look at jails, jails are different from prisons. And prison is generally where you'll go if you get convicted of a felony or serious crimes, and you're going to be serving out a punishment. And so you could get a 2-year sentence, you could get a 40-year sentence. We're talking about kind of going away from society for a significant period of time. Jail is mostly a pre-trial population. It is a massive number of people. So there's 10, 11 million people who cycle in and out of jails in a given year. That's 17, 18 times as many people as go to prison. And they're not all the most serious felonies. There's definitely people who get arrested for murder and for rape, but there's also people who are getting arrested and going to jail for traffic offenses, for unpaid fees and child support, for low-level offenses, nuisance crimes, things like that. And so it's a very diverse group, and the turnover is pretty rapid. So while there are certainly people who go to jail and stay in jail for a year or longer, most people, almost everybody, is in and out within a week. And that's, you can imagine how that contributes not just to COVID in the facility, but COVID in the community. If, like it can be its own kind of super spreader site. Jail is good at some things and not good at some other things. And I see Sheriff Clayton smiling, like he knows. So imagine, if you are a crime victim who has a perpetrator that is threatening harm, and you feel like you are in harm's way, having that perpetrator in jail can give you peace of mind and can give you some space to plan for your own safety. Jail is good at that. For a lot of other cases that don't have a victim or that don't have such a clear connection to public safety, jail can often do more harm than good. So a few nights in a jail cell often means, pretty much for everybody, means you lose your job. Depending on where your kids go, and most people who come to jail have kids, during that time, you could lose custody of your kids. That a really short period of time in jail can be pretty disruptive to your life, and that disruption, that sort of instability, can last a really long time. And so the researchers who've studied the sort of recidivism impacts will see over and over and over in study after study that going to jail generally increases the likelihood of future offending rather than decreasing it, which means there's kind of, some important value judgments here about, is it worth it to put this person in jail or to keep this person in jail if they've been arrested already? What are the public safety trade-offs in terms of what do you get for a few nights of incapacitation or a week or a year or whatever of incapacitation versus the possible negative outcomes? Another thing that has changed is that jail populations were not always this large. In the past 30, 40 years, jail populations across the country have tripled. And spending has gone way up. I think we just put out a report with the latest numbers on jail costs to taxpayers, about $25 billion. It comes out to something like $34,000 per jail bed if a jail bed's going to be filled for a year. And that's, that rivals the cost of private college, right? So had COVID struck 30, 40 years ago, the population in jail would have been much smaller. And the number of people coming in and out of jail would have been much smaller. And jails may not have been the super spreader that they were in this pandemic. So with COVID, and particularly in those first months, March, April, May, there was this huge urgency to reduce jail populations and say, we've got to do whatever we can just so we have options to try and separate people and have some social physical distancing. And so there's now really a lot of examples of what jurisdictions have done at the local level, at the state level, to bring jail populations down. And it's really fascinating to think about. Before COVID, all of the decision makers and policymakers who sort of said, you know what, this is somebody who needs to be in jail. But when pressed, when put into this sort of public health emergency, made different decisions and said, well, you know, maybe this person doesn't have to be in jail. Maybe this person doesn't have to be in jail. And those are arrest decisions. Those are pretrial release decisions. Those are sentencing decisions. Those are sort of throughout the whole justice system policy decisions that potentially could have a life post-COVID. And so we've seen in places like Michigan, where Sheriff Clayton and I have worked, we've seen the governor sign 20 bills just a couple of months ago to permanently reduce jail populations. And those bills do lots of things. They take a bunch of misdemeanors and they decriminalize them and say, you know what, these can be handled by the civil court system. They don't need a prosecutor and the threat of jail. This is low level. It doesn't really affect public safety. They, you know, dramatically expanded the use of citation in lieu of arrest, so that you know, most misdemeanors now, officers can give somebody a ticket and they don't have to arrest that person in order to address the crime. They changed how sentencing works for misdemeanors. So the presumption in Michigan law now is you're not going to go to jail for this. You know, you've been convicted of a misdemeanor and you're going to get probation. You've been convicted of a misdemeanor, you're going to get community service or a fine or something else. So there's a ton of ways that that at the state level, folks can change policy. You're going to hear more from Reagan and from others about local level policy change as well. And Michigan's planning to go further. So there's, you know, this year they're taking up what are all the ways that we can divert people who have mental illnesses away from the justice system? What are all the ways that we can safely expand pretrial release and have that debate in the legislature and see what can get passed? So happy to take questions on policy or jail population dynamics. I don't want to pass over my time, so I'm going to wrap up there and sort of end with there are a whole bunch of really interesting and exciting ways to focus jail beds on the people who need to be incapacitated and not on all the people who owe debt or who are involved in low-level crimes or who are picked up for traffic offenses and other things that that they could safely stay in the community for.
Great, thank you, Terry. I'm starting to wonder if these panelists have all worked in radio and TV, because we're sticking right to the time. It's amazing. This has never happened, and it'll all go to hell now that I said that. Not to jinx the next set of panelists, but we have two people who are going to present together, and I need to ask: do you know how, if you can share your screen with your? Okay, good. So I want to introduce them and then let them take it away. Dr. Reagan Daley is Research Director of the Cuny Institute for State and Local Governance, and Beverly Hauber is an Assistant Public Defender in St. Louis, both of whom have been working with the MacArthur Safety and Justice Challenge. I don't know if that's come up earlier in the conference, but they can tell you more about it. This very large grant program that is helping many localities around the country reduce their reliance on jails and change the jail culture. So take it away.
And hi, everyone. I'll kick us off for the Safety and Justice Challenge presentation. I'm Reagan Daley. Again, I'm the Research Director at the Cuny Institute for State and Local Governance. And we are a partner in the Safety and Justice Challenge, which is, as was just described, a national initiative funded by the John D. and Catherine T. MacArthur Foundation that aims to reduce the overuse and indiscriminate use of jails around this country, and also address racial inequities throughout the criminal justice system as part of that charge. And the way that we are doing this is to work locally. We're in 51 cities and counties around the country, 32 states, and each of these cities and counties has come up with a system-wide criminal justice reform plan that aims to address racial inequities and address the problem of over incarceration in their jails with a specific set of reforms and policies and practices that speak to the drivers of their local problems. And these strategies cover points across the system and all different sorts of approaches, strategies aimed at, reducing probation violations, case processing, expanding supervised pretrial release, and so on and so forth. I won't go into the full list of them because there's just too many. And I know that Beverly will get into more of what St. Louis, as one of our sites, is doing on the ground. But we've been at this for about 5 years now, and we're here to speak about both what we've seen at the initiative level in terms of progress to date, both pre-COVID and post-COVID. We've actually been able to look at the trends both in jail populations and racial and ethnic disparities at both points, and then talk a little bit about what it looks like locally in one site that has seen some success. So I have a couple of slides that I am going to share for my piece of the presentation, just to sort of ground the conversation in some visuals. And I'm going to pull them up now. Okay, can everybody see that? Okay, so we recently released a couple of reports last month that showed our progress to date on the initiative, both pre-COVID and then what's been happening since then. And I'm not going to get into too much detail, but there is a story that is emerging that is interesting and worth telling. And this first slide, I mean, what we've seen sort of across the board pre and post-COVID are pretty dramatic reductions in jail populations. And this slide here shows for each of our sites the reduction or the change in the jail population, both before COVID, which is the light bar, and then after COVID, which is the dark blue bar. And you can see, I mean, there's a lot of information in this slide, but one of the things that sort of jumps out is that we've seen a lot of progress in reducing jail populations in our sites, significant progress even before the pandemic hit. We've also seen, since the pandemic hit, even more dramatic reductions across even more of our sites. So we've seen a continuation of these trends, and our sites have implemented a lot of additional strategies, along with many other cities and counties around the country, in response to the pandemic, to keep people in the criminal justice system safe and really limit the jail population as much as possible. So we've seen a lot of progress in this respect across sites. Just to give you some high level numbers, since the initiative started, 2016 is when we began implementation. We've seen across all of our sites a 14% reduction through February 2020, which is right before COVID. We saw an additional 14 or 15% since then, and we've seen 27% reduction in our jail populations across sites since 2016 through October of 2020. So it's pretty dramatic. A lot of that has been driven by reductions in bookings, I will say. We've also seen reductions across racial and ethnic groups in the jail population, but despite those improvements in outcomes and reduction in harm, disparities have persisted across our sites, which is not a surprising trend. It is a disappointing one, of course, and that is an area where we are going even deeper moving forward. I just have this slide here to illustrate that point. This shows trends in booking rates for people of color across our sites. The chart on the left shows the change in overall booking rates for people of color. You see most of the changes are green, which means they've seen notable reductions. But when you look at the slide on the right, which shows, or the chart on the right, which shows how those changes compare to changes for white people, the numbers don't look so great, which means that essentially the booking rates are being outpaced by reductions for white people. And that is something that we are working hard to change. And then since the pandemic, we've seen more of the same trends in the area of racial and ethnic disparities as well. We've seen big reductions in many of these outcomes across different racial and ethnic groups, and we've looked at them for Black people, for Latinx people, for Native American populations, and the numbers are way down, but the disparities, again, you can see they've persisted in many of our sites, and this is an area that we are working to address in a more in-depth way moving forward in our sites. So I'm gonna stop there, and I think turn it over to Beverly to talk a little bit more about what the experience has been like in St. Louis and some of the work that they're doing on the ground. And I'm happy to answer questions, same as everybody else.
Thanks, Reagan. I'm Beverly Hauber. I'm the District Defender of the St. Louis County Public Defender's Office in St. Louis County, Missouri. Many of you are probably familiar with St. Louis County, and that Ferguson is located in St. Louis County. And of course, a few years ago, Ferguson got some very unwanted attention, but attention that has, I think, really prompted some change here in the country, and that is a good thing. So as a site with the MacArthur Safety and Justice Challenge, what we have been doing over the past 2 years is we've got a group of people together to say, what's going on in the jail and why are these numbers the way they are? And what we have discovered is that this is a collaboration, right? And I don't think that's really news to anyone, but it's something that a lot of folks don't want to actually participate in because it's a lot of hard work. And so we've gathered a group of stakeholders that include our prosecuting attorney, representative for the director of our jail, representative from probation and parole, the police department, of course, the public defender's office, and members of the private bar to sit down once a week and look at the jail population. We highlight very specific cases that we think we can address in that group. We also have a representative from the court, a judge from the courts, and say, why are they here? And do they need to stay here? And quite often the answer is no, they do not. It's a low-level felony. In the state of Missouri, our lowest levels are C, D, and E felonies. And that's where we had put most of our attention. And why are they here? What can we do to get them out? And how can we re-engage them in the community? Because every individual that we're talking about is a member of our community. And that's something that I think is so often forgotten. We look at the data, which is incredibly important, but the data represents people, and they represent someone's mother and cousin and son and brother. And we don't ever want to forget that. So when we're having those meetings, we call them our pre-trial meetings. We have them every Thursday morning at 8 a.m., bright and early. But it really gives us a good opportunity to dig into the individual. Another portion of that meeting is we've invited members of the community that we believe can assist us in providing wraparound services to those individuals, right? Because usually they're there, it's a drug offense, and they don't need to be in jail, they need drug treatment. Or maybe there's a mental health issue. So instead of treating the jails and the Department of Corrections as a mental health facility, which they most certainly are not, and will never be able to fulfill that need, let's get them connected with the services in the community that can assist them. And so that's what we have been working on in St. Louis. We have found success, and we are very proud of the work that we have done. There is still a lot of work left to be done. I think, as Terry was mentioning earlier, it's really important to note that, you know, jails are different than prisons. And here in the St. Louis County Jail, approximately 70% of our incarcerated are there pre-trial. So they have not been found guilty of or pled guilty to anything. And so having them there for whatever amount of time affects their life. And just like Terry said, we're talking about childcare, we're talking about housing, employment, all of those things you can lose 48 hours sitting in the jail. And it's important to remember that and think about that. So that's what we've been doing in St. Louis. We're very thankful to have the support of the MacArthur Foundation to help get all the right folks in the room to address the problem.
Okay, thank you. And finally, we have the most identifiable person on the panel. He's in uniform. Sheriff Jerry Clayton of Washtenaw County, which is Ann Arbor, Michigan, is going to talk to us about what's been happening in his county and in his jail, which Terry mentioned earlier, has worked with the Pew folks. So take it away, Sheriff.
Good afternoon. I'm going to try to keep the streak up and stay close to being on time. So happy to be here. And yeah, Terry mentioned, so we, you know, Michigan has done some work. I've some forward-leaning work around jail reform. And for us in Washtenaw County, none of it was a shock for us. COVID was a shock for us, but the response to COVID actually ended up being fairly seamless because I believe that the majority of folks that are in our jails don't need to be in our jails anyway. So think about Washtenaw County, of 55,000 people. The jail is about 405 beds, which is still too many, but small for a jurisdiction our size. And we reduced the population when COVID hit by more than 50%. I'm going to share a screen here in a minute just to show some of our forward-facing documents. But a couple things. For us, community health and safety meant jail health and safety. So Terry talked about it. From a jail standpoint, we know the average length of stay is less than 2 weeks. We know that a large percentage of folks are coming in and out. So how we're able to manage the jail population and keep COVID down was extremely important to us. So here's a couple of things that we did. We immediately put in place, our state has a jail overcrowding act that allows us to send information to the court and reduce the population and get people out. Well, even before COVID, we had been doing what we call pre-jail overcrowding. We had proactively been sending lists to the court around low-level offenders, people with low bond, encouraging the courts to release those individuals. So we'd already been having that practice. When COVID hit, we just ramped it up. And I'll give you a couple of concrete things that we did in conjunction with a lot of our police partners. We encouraged all of our police officers on the street to limit their traffic enforcement. So only the most egregious driving behavior should result in a contact that may result in someone getting to jail. So that's both for our staff safety, but it reduced the number of people going to jail. We work with the courts. So the courts gave us the latitude on bench warrants with low-level offenses to advise and release. So we're not bringing people into jail with bench warrants. And here's why this makes sense. In part of the statistics that we had been looking at prior to COVID, the third highest driving charge that landed people in our jail was driving while license suspended. So just think about that. Driving while license suspended, which is really a bench warrant, right? Because it was something else that happened, usually a traffic offense, tail light out, couldn't pay the bill, got a court date, didn't go to court, judge issued a bench warrant. So some of the changes that have happened at the state level really are moving us in the right direction. The other things that we did is we stayed in constant contact with the courts. We provided lists to them in terms of individuals in a number of categories. Low-level misdemeanor offenders, people with bonds of $1,000 or less, those with underlying medical conditions, those with release dates within a month. So every week we send that list to the courts. We vet it through the prosecutor's office and we vet it through some of our stakeholders, like our domestic violence advocates, to make sure that they have awareness of who's getting out. And we reduce the population. I just want to show really, really quick. Hopefully I can do this right. Can y'all see that? So I didn't mess it up. That's a miracle first in and of itself. I probably messed it up now. So I want to just take you through. So this is our website. So if you go to our website, these three buttons here at the bottom, our COVID update, jail summary. What we were getting was a lot of questions with the public. We were getting rumors that 50% of the population had COVID, that everybody was sick, that these things weren't going on. And we know in Washtenaw County, in the absence of facts, myths emerge. So we said, well, let's give people facts. So if you hit our jail summary button, I want to get right, here's what you see. So everyone can see how we have defined the population, the different areas of the jail, and what will result in people being in the areas of the jail. And you see the current population, who's in GP, precautionary observations. So this was populated on a daily basis. So every day you could go and see what our COVID numbers are. And you see at the bottom, from last March, we've had a total of 27 confirmed COVID cases. Even when we had and half of those were people who had COVID coming in, where we immediately tried to turn them right back around. Here's our release data. So this shows in March 1st of last year, our population was 332. We got down to a low of 146, and now we're at 170. So let me end with this. And Terry talked about it. COVID's been horrible for us, but if there's anything that's been beneficial for COVID, it should be to affirm what some of us have argued for a long period of time. Jail is the wrong place for a large percentage of the people. We have gotten out over half of the population, and guess what? In Washtenaw County, we haven't seen some crime spree or crime wave that everybody alleges when you start to let folks out. The only people that should be in jail are those that objectively have been identified as being serious threats to public safety. Someone that's on a bench warrant for driving while license suspended is not a threat to public safety, shouldn't be in jail, especially when we're in a COVID pandemic. I'll end right there.
Well, Sheriff, you just touched on what I think would be a great way to do the one last round robin with the panelists to talk about the lessons the lessons learned, and others have made this point that as rushed as it was, as horrible as it was, COVID taught some lessons that actually might have lasting impact, both medically and in terms of justice. So what I want to ask, just open it up to the panelists, what would you say have been the positive lessons learned so far with the experience around the country? Go ahead, Terry.
One thing that hasn't been mentioned yet is more about data. So how do I want to say this? So data is a problem in jails. And I think one of the reasons why, a lot of the laws and policies that affect who goes to jail and how long are made at the state level, but state lawmakers have no idea who's in jail. And that's because the data is in, 100 different places and it's not aggregated. And so the growth in jail populations has largely escaped scrutiny by lawmakers who have said, oh, now this is going to be against the law, or now this you don't have an opportunity to, you have to arrest for this, or whatever laws they put in the state level. I know there's local level decisions too, but one thing that seems to be a positive outcome of COVID is there are a lot more people asking who's in jail, how many people are in jail, and there are these new sort of channels of communication to sort of open up that closed world and sort of think about, well, what should we have in place in terms of data sharing? What should we have in place in terms of what shows up on our website, and being able to search and being able to sort of like ask big questions about whose liberty is being taken away and for how long, and that sort of thing. So I think that's sort of an interesting side effect.
Beverly, you unmuted. Do you have some
Sure,
observations?
I think something else that we've seen is specifically in St. Louis County here, because of COVID, our courts have been operating primarily in a virtual setting. We've been having court through video, which is something that we never did before. And just like Sheriff Clayton was saying, a lot of the folks that end up in the jail are because they missed a court date and therefore they got a warrant. When you allow for video court and for people to not have to take a half a day off work or find childcare or navigate the public transportation system to get to court, you help reduce the jail population and you help keep the community safe. And so I'm very hopeful that as we move forward in this, another part of preventing that jail population from increasing is let's not mess with these silly failure to appear warrants because someone couldn't get off work or because someone couldn't find someone to take care of their child. Video court is a fantastic option that really we have the technology now quite clearly, and we should continue to utilize it because it greatly impacts jail populations.
Any other observations on lessons learned, Sheriff?
Yeah, I think just really, really quick, I think the way I end it, I think that it affirms the fact that the people that we have had in jail weren't really this threat to public safety that we always said they were. So that's the first lesson. The other lesson is, and this is in conjunction with criminal justice reform, it is highlighted, criminal justice reform has highlighted that we have built large part of the criminal justice budget on the backs of poor people through fines, through costs associated with tether and things of that nature. So when you combine the fact that most of those people shouldn't be in jail, and oh yeah, by the way, we shouldn't charge people exorbitant amount of money to be on alternatives to incarceration, it will force local units of government to figure out how do you manage your criminal justice budget when a large percentage of your budget isn't fines and fees and on the backs of those unfortunate individuals. So it's going to be, I think it is a challenge for us moving forward.
How about on the medical front?
Oh yeah, actually, so in medicine we have these things called M&Ms, which are morbidity and mortality reviews, and it's a way for the hospital to come together, people involved in a case that did not go as well as planned, to really do like a root cause analysis and figure out, was it a communications failure, what things like that. And so as someone who works at a hospital, but also delivers healthcare in a jail, that sentiment of M&M, it doesn't fall into the jail realm as easy, I think, potentially because concerns about liability and what if we found that we did something wrong. But it is a needed natural process of growing, of seeing where things happen. And I feel like in the setting of COVID, when we thought we had things right and someone got COVID, it brought everyone to the table in a very natural way to say, how do we do better? It really facilitated that. And I don't know if it was just that, the hospitals were struggling, everyone was struggling. And so there was this unifying way that we're all struggling. And maybe it made the vulnerabilities of the people working in the jail to be like, I need to do better. I need to do better because it impacts me and my health. And so there's so many reasons why we need to do better. And so I hope that kind of mentality of something didn't go like we wanted, can we sit down and think about how we could do better, continues on. And I think, continues on. I remember as a medical school student, medical students weren't allowed at these conferences, but then as a resident, you were encouraged because you don't want to be ashamed when something happens if you can come to the table and think about how not to let it happen again. And so I think that's been a really beautiful thing lately about seeing people just wanting to make the system better.
Reagan, any other thoughts?
I think just a lot that echoes what's already been said. I think we've seen in the wake of this pandemic that you can reduce jail populations. You can do it quickly. You can do it safely. We're starting to see in the Safety and Justice Challenge. It didn't take years to do this. It took a matter of weeks to do this in a lot of sites. And these, are hopefully, strategies and efforts that can be sustained in some way, shape, or form in these jurisdictions. It was a real opportunity to push things that may not have been, politically palatable before. And we're seeing that it can be done.
We have a few questions already in the queue. I'm going to ask one question just to make sure that we don't miss this topic, but it's bail reform. And there's a lot of activity around the country, even at the state level, but especially at the local level, in enacting bail reform. There's also a lot of backlash. And I'm wondering, both politically and judicially, what effect will COVID and this whole experience have on the pressure to change bail systems around the country and maybe foster a better political environment? Anybody have experience with that or thoughts on that?
I'm happy to kick it off. I think, there are a lot of things that are putting new pressure on discussions around bail. I think I'm sure that, the sort of experimentation around broader pretrial release during COVID could have some kind of cultural change impact. We've got about a year now of people making different types of pretrial release decisions. That sometimes that just sticks, whether you change your policy or not. But I think that the big pressure right now, one of the main ones is constitutional. There's litigation that people who are jailed because they can't afford to pay their bail are bringing, that's about it's unconstitutional to discriminate between rich people and poor people when it comes to liberty. Liberty is a fundamental right in America. Liberty is, it's what the country's based on. Or sort of challenging that, hey, I didn't actually get a meaningful hearing about whether I should be detained or released. I just had a quick 2-minute hearing and it said $2,500 bail and that was it. That's deprivation of due process, which is a constitutional issue. So I think that fairly soon, already, the courts are taking this up, and fairly soon the Supreme Court's going to take it up. And I think all states and counties are very soon going to be soon going to be forced to really change how they do their pretrial policies.
So something that's happening in Missouri and in St. Louis. So before COVID, a new rule came out of Missouri, Rule 33, that was designed to address those issues of bail for poor people, for the indigent, and why was it being treated differently, and why are you sitting in jail just because you're poor? If you had $500, you would not be here, but you don't have it, so you sit. That's a problem. Terry was talking about the constitutionality of it all, and more people need to talk about it because it is being ignored, quite frankly. And the assumption is, well, sorry that you can't pay for it. Well, and that's not okay. That's not okay. And something that we've been fortunate to have here in St. Louis County is, again, the MacArthur program has helped fund limited representation attorneys. So attorneys that are going to be with you at that first bond hearing. In Missouri, you get a bond hearing within 48 hours of being incarcerated, and you need an attorney. You can't handle those things on your own, quite frankly. And because we have that support from the MacArthur Foundation, we've got lawyers that are there every day to represent people at that initial bail hearing, so that we can make the efforts to get them out before it goes to the level of losing your house, childcare, your job, all of those things that we previously discussed. But that's not happening everywhere, and it should be. And sitting in jail for days or weeks or months without having a lawyer, because public defender services aren't funded across this country generally, most certainly not in Missouri, and not having someone assist you through this process is a problem with bail. And so bail reform has to include not only looking at the discrepancies that are done between the poor and the wealthy, but also getting those lawyers in the courtroom to help individuals advocate for themselves. It's critical to that. And we've been happy to have some more success with that here, but there's still plenty of work that needs to be done.
I'm going to dip into the Q&A from the audience now to give enough time to that. And with apologies, I will get to the first two questions, but I want to jump to the third question because I think Dr. Wurcel may have something to say about it, and she has another commitment, and I want to get to this before we lose her. Anna Bryson, a reporting fellow, asked, does anybody have advice on how to get accurate information from a jail on its medical practices when they are contracted with a private medical provider and do not release information? I assume this will depend on state open records laws to some extent, but any thoughts on how to get that kind of information when it's contracted out?
I don't know exactly what the reporter's meaning by medical practices, because there's, in Massachusetts, our healthcare is contracted out for profits as well, to WellPath, to several different groups. And I think medical practices, if there's any way to get clarity on that, I mean, if it's about how they offer COVID testing, or, what are the criteria for COVID testing, or how often they offer COVID testing. If it's organized through the for-profit, I can understand that you are going to get challenges to get that information. And I don't have, and I run up with this issue as well. And I guess I wish I had an easy answer. If there's a way to tell me kind of exactly what you mean by medical practices, the thing to say about jails is you can find out if your jail is accredited, and whether it's accredited by the NCCHC or whether it's accredited by the AJA. And so it's very high level, like what that means, but they're supposed to, if they're accredited, follow certain medical practices. You can even order the book, which I did, which sort of says what they're supposed to be doing. Now, granted, the page on infectious diseases says, like, test and vaccinate as appropriate. So it is a little bit nebulous and there's room there, but that would be one step, is to see if the jail you're talking about is accredited, then you can, I would think, have some faith that they're following some instructions from that. But it's a huge challenge.
Anna, I just opened your mic, Anna. So if you want to elaborate, go ahead.
Hi, thank you. Yeah, so it's a jail in Florida, so our records laws are pretty good here, but even though we do have good open record laws, they're contracted with Corizon. And so basically, I haven't been able to get any information on the amount of COVID cases. Are they doing COVID testing? And even beyond COVID, things like how many medical complaints were there last year? Things about inmate suicides. I've just really been having a hard time getting any information related to medical anything.
I wonder if legislative oversight committee would be helpful in addition to going to the state health authorities. And just a thought.
The DPH was not able to make that happen. It was through the SJC, which I don't know a lot of these letters. It's sort of alphabet soup to me, but I don't know if every state has an SJC, but I think the SJC eventually ordered transparency in that. And so it's reported on a dashboard to the community. But that's a Massachusetts thing, not a Florida thing. There are incredible, I don't know if you know Catherine Nowotny, she's at University of Miami. She's one of the co-founders of COVID Prison Project. If you want help with it, she's the right person to reach out to. She's working in the DOC and she has tons of connections, and it might just be finding someone on the inside who helps get you that information. But yes, certain states are very closed about what they're going to offer up.
Okay, we have another 5 minutes or so we can fit in a few more questions, maybe at least one.
Okay, we had a question from Joseph Shafari from Spotlight, Pennsylvania, talking about jails were also affected by H1N1 a decade ago. Historically, what has happened during the 2008 pandemic in prisons, and what was the response then compared to now in prisons? Keeping in mind we're talking here about jails, but I assume folks here may know the prison experience too. But what happened in the interim? Did we learn anything from that?
No, I mean, so I actually wrote a paper about this recently, just looking to whatever research was out there about how H1N1 or actually flu in general has been handled in the past in prisons and jails. And you could really count on one hand the amount of research reports just showing how flu vaccine is distributed, where you get it from. If you were to, Ann Spalding did, I think, one of the major articles on H1N1 where she interviewed federal prisons, I think, and sort of surveyed whether they even had the vaccine. And most of them did not. I think overall there's an overarching assumption that either people in jail are not deserving of vaccination or that they won't accept vaccination. And so unfortunately, since that pandemic, having been a doctor since that pandemic, have not seen a response. There was no response. I think a lot of jails had pandemic preparedness teams potentially, and flu preparedness teams and things like that. But I think what I wish would happen in a perfect world is that we would all know how many vaccines are given out and where the vaccines are ordered from, and sort of be able to say, even benchmark jails, say, oh, wow, it looks like one jail is having a really great season where 30% of the people have accepted the flu season, but this jail doesn't. Oh, they're offering it every day during phone time. That's why people aren't getting a flu vaccinated. Could they make another flu vaccine offering time? Like these small little things. So I don't think we haven't advanced much since 2008.
Like everywhere else in society. Another good question from Joseph in the queue has to do with the Safety and Justice Challenge data that was up on the screen. He said, I noticed the slide mentioning Allegheny, which is Pittsburgh, and Philly is having a reduced jail population rate, but we've been finding in those areas, just like in many other larger county jails in Pennsylvania, populations are going back up to their pre-COVID levels. In some of the county jails like Allentown, they're above pre-COVID levels. Where is the disconnect? Any reasons why you all think this is happening in certain areas? I would say in a lot of areas, a bounce back.
Yeah, I could speak to this one. I mean, according to the data that we have, both of those sites are still below their pre-COVID levels. I mean, we have seen in our sites, as we've seen across the country, that, after the first few months immediately following the pandemic, that was when the jail population levels were lowest. That was when restrictions were heaviest, and the reform efforts and responses that were put into place in the criminal justice systems, I would say, were most intensive. As we got further away from that point, I mean, what's been happening everywhere is that some of these restrictions have loosened. I know in a lot of our sites, the reductions were driven largely by reductions in bookings, which stem from arrests and changes in police practices. And those practices have also evolved as the pandemic has evolved as well. And so as arrests go back up, bookings go back up, you see a little bit of a evening out of that. Another factor I think that's at play in a lot of jurisdictions is case processing backlogs and court backlogs that have happened as courts have had to shut down or really pare back on their appearances. And so it just creates a backlog in the jails as well when these cases are not moving along at a pace that they usually do. And so that combination of factors, I think, probably has driven a lot of those changes in sites. But I do want to clarify that at least in our sites, yes, those numbers haven't stayed as dramatically low across the board as they were in April and May, but we're still seeing that they are pretty well below where they were in February 2020 in a lot of our sites.
Yeah, and I would just say that we just have to continue to track it. So to what was just stated, let's also talk about activity. In so many states and so many areas, people were restricted, they were home. They weren't at bars, they weren't at places. So there wasn't the opportunity to have interaction that results in arrest. So as things start to loosen up and the potential for interaction between police and members of the community increase, you should expect some of those numbers to go up. But if we stay true to the belief that a majority of folks shouldn't be in jail, those increases should not return to the pre-COVID numbers. If they do, it's because we have not learned our criminal justice lessons.
I think it's also really important to note the case processing. That is a huge component of this that many courts are struggling with. How do we continue to move forward with the criminal justice system when, for example, you can't have a jury trial? If they're not having a jury trial, how do we get that case processed, and how do we balance the need to keep them incarcerated? And case processing is a challenge, and it's an incredibly important component that people can't get relaxed on and just kind of say, we'll figure it out. That's not an option. And what we saw at the beginning of COVID was that although we were able to reduce numbers quickly and drastically, it still took a lot of work, and it took getting a lot of people in the same room to have uncomfortable conversations. And I think what has happened as COVID has gone on at a year now, people don't want to put in that work sometimes anymore, and they've gotten a little bit more comfortable, and we just can't go that route. We got to continue to push and continue to remember that every person we're talking about is a person, and they don't generally need to be in jail.
I don't want to let that remark go away, because I think it's probably one of the most important things I've heard in a really interesting day. But we've gotten used to COVID now, and at first COVID was supposed to be it was going to inspire us to really think in terms of real reform and show what we can do when we don't have a higher incarcerated population. Now we're threatening to get used to it, and any of the lessons we might have taken from reform this year are in danger of being lost. It's a really interesting point. Thank you, Beverly, for making it.
Steve, do you need to cut us off, or do you have time for one more question?
I think so. Is there another question that's in the back there that you want to pick up?
There isn't, but I had one. I just don't want to drag it out if people are ready to pull the plug.
Over to you.
We haven't talked about local budgets, and every government is reeling under the effects of the hit to taxes that the economy has inflicted thanks to the pandemic. So how does that play out in this discussion about jails, whether to build a new jail, whether it strengthens the cost arguments when you say that you can reduce incarceration? How does the budget pressure factor into this?
If you don't answer in very briefly in maybe 30 or 60-second bites, sound bites each.
Sheriff, are you seeing that at your level?
Yeah, I think we haven't gotten hit hard, but we know it's coming. And I'll go back to what I said before. Criminal justice reform, COVID, all these things are coming up at the same time. So there's a strain on the budget. There's conversations about not balancing your budget on the backs of people that you arrest. So at a local government level, there's going to be some decisions that have to be made, and there's going to be conversations about where we invest, and also the whole defund police, defund the criminal justice system. All of that's coming together. Elected officials are going to have to make some tough decisions.
You know, there's a lot of the jail costs are about the staffing, salaries, and healthcare and stuff like that, or healthcare for the people who are incarcerated as well. So there may be some natural savings as the population goes down related to, well, there are fewer people to offer healthcare services to, but there's also all of these extra now health related costs that are part of the pandemic. I think that if it's possible to, in a sustainable way, keep jail populations down by a quarter or a third or some significant amount, assuming that there's some amount of natural attrition among the staff and people who get burnt out and or leave for other jobs and that sort of thing, that there's an opportunity, depending on how the jail's designed, to say, you know, we're not going to fill that position. We're able to actually support a smaller jail population with fewer staff members. And that's a place where counties really could save quite a bit of money.
Well, I think I really appreciate the panel's contributions today, and not just in timeliness, but in substance. So thank you very much.
And thank you especially to Mark for being a brilliant moderator. We shepherded 5 panelists right through it, and we landed more or less on time. So thank you, Mark. Thank you all. Thank all of you.